So I was having a discussion with someone who was told that having a high-fat, low-carbohydrate diet could cause insulin resistance. And this is technically true. However, we need to delineate between pathological insulin resistance and physiological insulin resistance. First of all, what is insulin resistance? Insulin is a hormone produced by the pancreas in response to an elevated blood glucose. It is actually the entrance of glucose into the pancreatic beta cells that will cause the release of insulin. And insulin has receptors on many different cells all around our body. When insulin binds to its receptor, it causes what's referred to as a phosphorylation cascade. And that may sound scary, but all this really means is that it will increase the activity of different proteins inside the cell. Simply, we have a lot of different proteins inside of our cell, and not all of them can be active at one time. And inside the cell, we actually use phosphorylation to turn on or off different proteins at different times. And phosphorylation is simply adding a molecule of phosphate to a protein, and this gives it the energy to either stop functioning or start functioning. And all of the proteins that are phosphorylated by the insulin binding to its receptor are responsible for an increased uptake of glucose, fatty acids, and amino acids from our bloodstream. Additionally, they increase glycogen synthesis, which is simply the storage form of glucose, increase triglyceride synthesis, which is actually how we store fat, and increase protein synthesis, which is what the amino acids are used for. And finally, it will inhibit the breakdown of glycogen, the release of fatty acids into the bloodstream, and the breakdown of protein. So technically, insulin will limit our ability to actually release body fat. But that's a little bit besides the point. The important thing is that all of these proteins are required in proper insulin signaling. Simply, insulin doesn't actually do anything unless these proteins are phosphorylated and allow for all the functions I mentioned. Insulin resistance is when insulin will actually bind to the receptor, but something happens in the process of these proteins being phosphorylated that doesn't lead to the eventual outcome that we're looking for. And as a result, the cells won't uptake fatty acids from the bloodstream, uptake glucose, or uptake amino acids. And this means that the cells will actually be low on energy and may have a difficult time going through protein synthesis. And while it may sound like a good thing for our cells not to be uptaking fat, this fat will eventually be deposited inside of some of our vital organs. When fat isn't absorbed by the fat cells or the muscle cells, this excess fat is deposited in places that we do not want it. So what is actually going to inhibit these molecules inside of the cell from working? One of the biggest things is actually the accumulation of fat inside of a cell. When fat accumulates inside of the cell, it can be turned into what are called lipid metabolites. So the healthy storage of fat is in the form of a triglyceride. However, sometimes these triglycerides can actually be transformed into ceramides and diglycerides. And these molecules will actually bind to some of the proteins I discussed and actually stop them from functioning. And this is what causes the insulin resistance or the messed up insulin signaling. And this is why the onset of insulin resistance is fairly tightly correlated with an increase in body fat. And when we're on a high-fat, low-carbohydrate diet, we'll actually reduce the use of glucose as energy and increase the use of fat. However, we'll also drastically increase the entrance of fat into the cell, meaning that the cells are kind of exposed to just as much fat as they would be if we were gaining weight, even though most of this fat will be used as energy. And as a result of increased exposure to fat, we'll build up more of these lipid metabolites. And this can actually cause physiological insulin resistance, or simply a transient amount of time where we do become insulin resistant. And it's simply as a result of using a lot of fat for energy. But when we're eating a high-fat, low-carbohydrate diet, this really doesn't have much of an effect, simply because we don't need much insulin. However, just like the process of losing weight can restore insulin sensitivity, because the cell will be exposed to less fat and have less of these lipid metabolites, Simply just lowering our fat consumption for a period of time can very quickly reverse this process. And this is actually quite important for someone who is a diabetic. Diabetics often go in for glucose tolerance tests, where they actually will eat glucose and see their ability to uptake this glucose out of the bloodstream. But if you've been following a low carbohydrate diet for a while, trying to reverse diabetes, when you go in for this glucose tolerance test, even if you are much healthier, because you may actually have developed physiological insulin resistance, it may appear that you're still glucose intolerant. And this could actually alter the medications that you're given and change a lot of the practices your doctor chooses to take. Luckily, physiological insulin resistance can be reversed a lot quicker than pathological insulin resistance. And you'd simply just have to decrease fat consumption and increase carbohydrate consumption for a few days. So in order to get the most accurate reading on a glucose tolerance test, you may actually want to reintroduce carbohydrates for a week prior to any sort of glucose tolerance test. The reason why physiological insulin resistance is different from pathological insulin resistance is because when you have pathological insulin resistance, your body is always producing a large amount of insulin. But when you have physiological insulin resistance, this is actually because for a long period of time you were not producing much insulin. Which means that once you restore proper insulin signaling, the normal amount of insulin your body produces will fulfill all of its functions. But in pathological insulin resistance, your body's producing as much insulin as it can, which is also going to put a lot of strain on your pancreas because of how much insulin is needed to be produced. With that being said, I hope you found this interesting, and I hope I have the pleasure of speaking to you next video.